Hello, everyone. My name is Annie Gebbe, and I'm an Oncology Outreach Coordinator for the Samaritan Cancer Resource Center, and I will be your host for today's webinar, Lymphedema, Understanding the Basics of this Condition. As a reminder, all lines will be muted. This presentation will be recorded and provided to you in a follow-up email. Today's event is brought to you by the Samaritan Cancer Resource Centers. Our mission is to partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. Please submit any questions to the Q&A box. Questions will be monitored throughout the duration of the presentation and answered at the end of the presentation. It is now my pleasure to introduce you to today's presenter, Cindy Davis. Her focus and passion are in providing rehab to reduce and prevent side effects as you go through your cancer journey. Her services include modalities and methods that help reduce the risk of lymphedema, reduce swelling and pain responses, alleviate scar tissue, and improve functional reach. In her life outside of clinical practice, Cindy enjoys hiking, camping, and spending time with her son. It's now my pleasure to turn over the presentation to Cindy.
Hey, everybody. Not sure who all's on. Thank you, Annie and Carmen, my lovely assistants. You're so helpful. Basically, for those of you that have heard me talk, a lot of this might be redundant and repetitive, but I always like to talk about the basics, partly because it's so misunderstood in the world of medicine in terms of what lymphedema is. What is it not? You can see over my shoulder, Mr. or Mrs., I'm not sure, lymph system over there on the wall. That is our lymph system in a nutshell. Basically, when we talk about lymphedema, the patients that I see in the cancer center, pretty much for the most part, have had at least one lymph node removed. Some people have had 3 or 4, some people have had a full axillary dissection, or my head and neck patients who have lymph nodes removed on the neck. So lymphedema is a condition that I prefer to try to prevent with people. Once it's developed, it's a chronic, permanent situation that's pretty stressful for people to have to manage over a lifetime. So if you're missing a lymph node or lymph nodes, you are at risk for lymphedema for a lifelong precaution. So when I'm seeing somebody who's post-operative lumpectomy, mastectomy, lymph node neck dissection, basically the first thing I like to talk to them about is how to prevent lymphedema. So basically, the rule of thumb is try to avoid, for example, if your lymph node was removed over here, for the duration of the lifetime, you want to avoid any trauma to that side of your body. The biggest things that you can prevent and avoid are shots, immunizations, blood draws, blood pressure cuffs, finger pokes, even sometimes the manicures that people do with acrylic nails. Sometimes the process of that even makes me nervous if you're missing a significant number of lymph nodes. The lymph system does not know the difference between a gash cut or a hot pack or a flu shot. The lymph system goes into a flush it out mode to take care of that injury. So the things that we can avoid, the things that we can prevent are things that we should prevent so that the lymph system doesn't get overtaxed or overloaded. So one way to think about it is if I was born with, we don't know how many lymph nodes we're born with, by the way. That's the big question for all of us, is how many lymph nodes was I born with in this quadrant of my body? I don't know that. We don't have a good way of testing that. So if I'm missing a few lymph nodes over here, let's just pretend I'm missing 4 lymph nodes, and I have had an injury such as, let's pretend I fell. That happens once in a while, but I fall while I'm out fishing or something, and I land on that arm. Well, normally landing on something or injuring something, your body goes into an inflammatory response and sends fluid to that injury to clean it out. That's what it's supposed to do. So is that lymphedema or is that edema? Edema is water swelling. The best example of that is, oh, I remember I twisted my ankle and that swelled up, that went away. Or I remember when I landed on my hand and injured my hand and it got all puffy and bruisey, but when I elevated it and pumped a ball, that swelling went away. Well, that's edema, that's water. Lymph swelling is protein, really thick protein fluid. And it's fluid that will not be absorbed through capillaries, arteries, veins. It has to leave the system through lymph vessels, which are all the long stringy things on Mr. Lymph system over here. So knowing what's lymphedema and what's edema can be tricky. Usually I can tweeze things like that out and figure out, is it edema or is it lymphedema? But sometimes it's hard for you to know. So biggest thing is, you know, try, if you're missing lymph nodes, try to prevent injury here when you can, the things that you can prevent. When things do happen from time to time, I will have somebody contact me and say, oh no, I had whatever happen. Am I going to swell up? I don't know. We don't know if you're going to swell up. If you do have swelling that seems to be persisting, you do want to see your physician and get a referral and get into CS soon. There are different stages of lymphedema. So if we can, and with those stages of lymphedema, the earlier we can address that kind of swelling, we potentially can stop it and reverse it with a series of things that I would show you how to do. If from time to time I'll have a patient that'll come in to see me and they will have been swollen for 15 years. Those are scenarios where it's really hard to get that to reduce. We do all of the teaching of the things that have to happen at home around the clock to try to get that swelling reduced. We have obviously things that we do to people, to clients, when they're in our treatment room here, things that you cannot do at home to help reduce that kind of swelling. So rule of thumb is, number one, best to prevent any kind of lymphedema issues. Number two, if some swelling does start to happen, definitely number one, stay on top of it. Number two, if it's not improving with elevation and pumping and ibuprofen or whatever you would do for an injury, if it's not improving, see your doctor, get a referral, and come in and see either Lisa Goodrich or I, and we'll get on top of that. Probably what we would do is get you into a compression sleeve, but we would also teach you lymph massage. We'll do some lymph massage with you. We'll do some modalities with you. That's kind of how we tackle things here in our little tiny home in the cancer center. We really like to see people who have recently had surgery and have conversations about, okay, so X amount of lymph nodes were needed to be taken. So this puts you in a rough guesstimate risk factor for lymphedema. So we really like to put it into perspective for you in terms of how many lymph nodes you have had removed. Does that put me at a high risk, a moderate to low risk, or a low risk? So, but then the other thing we like to do, if we see you here in our clinic, is talk about what are the next adventures in your journey. Are you needing radiation? Are you not needing radiation? For some people, when we see them post-surgically, there's not really too much going on and they're functioning well, they're moving great, they're not really having any significant pain syndromes, and we can just do a one and done little tutorial, kind of the things that I just talked to you about, in terms of how to be aware and proactive with your lymph system. So that's about it about lymphedema risk. Knowing that it's a lifelong precaution is crucial for you. Knowing to be your own advocate is crucial for you, because lymphedema risk, lymphedema in general is such a unknown territory for most people who are medically trained. I did not learn this in therapy school. I did not learn this in anatomy physiology. And as a general rule, in medical school, we don't really learn about lymphedema unless we've chosen to go out and study that. So what I'm getting at is being your own advocate is going to be crucial. So say it's 10 years after your breast surgery and you are missing lymph nodes, and somebody tells you, oh, well, you're not at risk anymore, I'm going to go ahead and use that arm for your vaccine. You really do need to be your own advocate, because if you do develop lymphedema, you're the one that will need to, my laptop just tried to turn off, don't do that. You're the one that will need to deal with that condition. So really being your own advocate, being proactive. You've got your other arm that you can use. Just get in the habit of protecting yourself. Always when I'm talking, I have little ideas that flit through my head. Oh, I need to mention this, I need to mention that. So anyway, that is the basics of just general lymphedema. What is it? What isn't it? Risk reduction practices, things like that. Oftentimes I will have someone who will come into my clinic and there will be some leg swelling. That's always where I have to figure out, say, if it's a breast cancer patient and there's leg swelling, that doesn't have anything to do with the fact that you had nodes removed. Let me grab a handout to show you. If I can find it. Okay, here we go. This handout here, there we go, cover up my face, shows you watersheds, if you guys can see that. The lymph system really, truly is broken up into, I call them counties. They really are watersheds. So if you've had lymph nodes removed over here, you're not going to get swelling over here or up here or down here. You really would only have potential to have swelling or issues over here. So those are the watersheds. So from time to time, if we have somebody who's come in who has also some leg swelling going on, we've got to sort of tweeze that out and figure out, why would your legs be swelling? Sometimes it's from chemotherapy. Chemotherapy can just make a lot of your systems and your organs not work quite as well as they did before, and there can be leg swelling. And usually scenarios like that, people say, oh, well, once I've been in bed all night and I get up in the morning, my legs aren't swollen. Remember what I just said about water? With elevation, water leaves the system, water runs downhill. When you're flat on a bed, if you have ankle swelling, you can elevate your legs and pump your ankles, and oftentimes that'll go away. That's edema, that's water. That does leave the system through the capillaries, the veins, the blood system. If you have lymphedema in your legs, or even mixed edema, different things cause that you probably won't need to deal with. If there's mixed edema going on, that's usually caused by vascular problems, vascular issues, chronic venous insufficiency, people who have sort of the dark staining going on the bottoms of their legs, the fronts of their shins. That is something that's vascular. So us lymphedema therapists tackle that a little bit differently. So yeah, if you had ankle swelling after having had breast cancer, that's more likely an issue of possibly the doctors would want to check your labs. Are you having some neutropenia? Are you having some protein absorption issues from your chemo? Things like that. So that's part of what Lisa and I do in here, is a little bit of CSI investigating. Why is that swollen? Trying to figure out and tweeze out what exactly is happening, which brings me to a thought that I just came back into my brain. Pain. So this is a huge misconception with lymphedema, that lymphedema is a horribly painful condition. So let me tweeze that out, please. Lymphedema in and of itself is not painful. So if, for example, someone comes into my office, and this has happened, someone comes into my office and they can hardly move their arm and it hurts really bad and it's really swollen. That's not lymphedema. That would be a client that I would send to the emergency room to have an ultrasound done to make sure you don't have a blood clot, because to me that sounds like a blood clot. So lymphedema is not painful. However, if you have an underlying condition such as fibromyalgia, multiple sclerosis, a nerve, a pinched nerve, carpal tunnel, I could go on and on and on. If you have an underlying condition, sorry, my computer keeps wanting to go to sleep, and then in that same area you have some swelling that starts to happen, then there can be some pain. But I tweezed that out because it's not just the lymphedema that's causing the pain, it's that underlying condition. So if you just have swelling, it's not going to be painful. So we need to figure out, where's that pain coming from. It's common after a lumpectomy, mastectomy, axillary node dissection. It's common, in fact, I would say always, for you to have unusual nerve pains happening while that's healing. We call them zingers. They're unpredictable, they're not caused by movement, and it really is the nerves healing from that procedure and that surgery. The other thing that can cause pain, which we treat a lot in our clinic here, we call it cording, axillary web syndrome. Let's talk about that for a minute. I'm sure someone has heard of that or had that themselves, or I've worked on those for you. After a surgical resection of cancer, and we've removed a lymph node or some lymph nodes, sometimes even on a side where we've not removed lymph nodes, people can get cording. And what we think it is we think it is scar tissue. Again, going back to these long strings of lymph vessels, we think cording is scar tissue that has started in your incision and wound up a lymph vessel. For some people, they stop at the elbow. For some people, they go up into the forearm. And if you have cording, your biggest symptom is going to be when you go to reach for something, ow, it pulls on you. When you try to do your post-surgical stretches, it hurts and it burns. It's kind of a long burning pain along the arm. I've even seen them happen for people who had drains from their surgery. I've even seen it happen in their trunk around their ribs where they've had drains placed at one point. So that is cording. That is not lymphedema. Cording is scar tissue. So cording is something that we can definitely work with you on here. All kinds of tools and tricks and tape and things that we can apply to cording to improve that for you literally in 10 minutes. So cording usually happens soon after surgery. However, I have had from time to time patients come in 2 years after they're done with all their cancer treatment with a new cord. Or and sometimes they know why it happened. Usually they don't know, what the heck is this? How come this is happening now? I don't know why it's happening now, but let's just make it go away. So Lisa and I really see that frequently. I do want to talk about post-radiation breast pain, just so that you're aware of it. This is always hard, not knowing, with the 15 of y'all who are joining us today, is not knowing where you're at in your journey. So I just like to bring things up that I talk to my clients about, just so that they're prepared for it. Post-radiation breast pain is something that catches everybody off guard. So if you've had breast conserving surgery, say lumpectomy, wide excision sort of a surgery, and then you go on to have radiation, oftentimes when you're done with your radiation, there's sort of a 2 or 3 week healing process that happens where your skin's still sort of breaking down. It's uncomfortable, the breast is a little bit swollen and tender. And then that starts to heal after 2 or 3 weeks, sometimes 4, everybody's different. And then as that starts to heal, everything's getting better, everything's getting better, everything's getting better. But then all of a sudden, 6 months after your last radiation treatment, you've got new breast pain. Don't panic. Don't panic, but definitely speak up and talk to your oncologist about that breast pain. We have a low-level laser in here that is amazing for stopping that breast pain. I can't tell you how many people get it and how many people don't get it, because if you don't have post-radiation breast pain, I wouldn't be seeing you in my clinic. So I kind of have a skewed perspective of that diagnosis, because we treat that in here every day. So the biggest caveat to that, number one, is don't feel like you have to just suffer through that pain. Speak up, tell your oncologist about it. They will get a referral in for you to see us here in the lymphedema clinic. Honestly, that very first session with that low-level laser will take care of that. It will knock that nerve pain down by at least 50% just on that first session. So speak up is the biggest, I guess. And the other thing with that kind of breast pain 6 months after your radiation's done, our brain is normally going to tell us something naughty, like, oh my gosh, no, the cancer's back. That's not what that is. That really is not what that is. That's your nerves healing from the damage of the radiation. Radiation really it can take months to really heal from what radiation has needed to do to control and get rid of any cells there. So that's post-radiation breast pain. I'm trying to think. The other things that can happen with breast tissue with radiation is skin thickening. Some people get almost an orange peel texture to the skin after radiation. Some of that we can help with the laser and some of the tools that we have in here. Sometimes we'll add a fancy little striped pad in your bra to help move that tissue around. Some people get pretty tight after radiation, so a lot of what Lisa and I can help in terms of tightness after radiation. We like to show everybody stretches that are good to do for months to years, long term after radiation, during radiation for sure. But then we can do some fascial work. We really like to help reduce those symptoms as much as we can for you. That's really what Lisa and I are here for, is to help reduce the side effects of your cancer treatment. The fatigue that comes with your cancer treatment, unfortunately, we can't help you with that. The best medicine for fatigue that comes with cancer treatment is exercise. 30 minutes of getting your heart rate up just a little bit every day actually releases some natural medicines from your body, your dopamines, your serotonin, your happy, feel good, natural drugs that come from your body. That's going to come from 30 minutes of light activity, exercise in a day. That's going to come from snuggling a baby or your kitty cat, or the feel good natural chemistry of your body. So yeah, I definitely would like to answer questions for everyone in terms of what I just talked about. or things that I didn't talk about, but I didn't bring up, I'm happy to answer questions. I think Annie's keeping an eye on.
Yes, I am.
Questions here. So if that's enough information, I don't have a whole lot else to cover without getting into some frustrating details of things that you really might not need to know about. So I'm happy to answer questions at this point.
Okay, awesome. We will transition then. Just a moment here.
Sure.
Thank you so much, Cindy. I'm just going to allow folks a couple extra moments to write in questions, and I'm just going to go over a couple quick slides with some additional information. If you'd like to obtain more resources and information about lymphedema or cancer, please feel free to contact us at the Cancer Resource Center by phone, email, or visiting our website. We do host monthly virtual education events that are on cancer-related topics such as this. So if you're interested in upcoming events and want to learn more, please contact us by any of the ways mentioned on this slide, and we can also get you on our list to receive our monthly newsletter. The next webinar in our Healthy Minds, Healthy Bodies virtual education series will be Cancer and Heart Disease. Is there a connection? Which will be held on Wednesday, November 17th. If you're interested in joining any of the other upcoming Healthy Minds, Healthy Bodies seminars, which are on the website, please visit samhealth.org/behealthy. And we'll get back to the questions. We do have a few. First off, we have a question saying, I've had a laryngectomy and I've had lymphedema in my face. What can I do for that?
I can answer that sort of. I can't really give you a full treatment plan without a physician's order. However, if you were in to see us for an evaluation and a treatment, the first thing we do is we look at where is your swelling and how do we compress that. Compression is magical for head and neck swelling. Doing compression on the face gets a little more complicated, but we get creative with that as well. So basically, if you have head and neck lymphedema, head and neck swelling, we figure out how for you to do compression. We teach you lymph drainage massage because it's really, especially with head and neck, it's really easy because it's right there. It's right there. That swelling is going to come right down into, for those of you who have seen me before, we talk about the rain gutter, right? Right here is where the lymph fluid connects into the bloodstream and then goes somewhere else. So we would teach you how to clear the lymph system, how to move fluid to different areas of the body. So really that's what we would be doing with you if you had swelling in the head and neck area. Compression, lymph drainage massage. Sometimes we'll use KT tape, sports tape, like you see the athletes wear. We will use, we have a fancy taping method that we use to help move fluid from maybe even the cheek around to the back of the neck or down to the collarbone. So those are the things that we would do to help you with swelling of the head and neck. Hopefully that answers your question.
All right, next up, this is a little bit more of a comment than a question, but it says self-lymph massage always from armpit towards your heart and never towards fingertips. Can you comment on that?
Oh, definitely. I think a lot of people, when they think of moving swelling out of the body, a lot of us intuitively and instinctively think if we push it towards the fingers, it will reduce. Unfortunately, it will, unless we had little spigots or faucets on the tips of our fingers, then that might work great. But really, we need the swelling to go, you are very correct, towards the heart, towards the heart, towards the heart. Dry brushing is fantastic for the lymph system. You could get on YouTube and type in dry brushing for the body, and You'll get thousands of videos on how to dry brush, but you're correct. If you're missing lymph nodes from, if you had breast cancer and they took lymph nodes, they would have taken those from the armpit. So if it was your left armpit, you would be pressing in that armpit and then towards your heart to move fluid. It's a little more complicated. There's a lot more detail that we add to that, but you're definitely correct in that you don't want to lymph massage towards the hand. You want to push the fluid towards the heart.
Thank you. Still have a few more. Are there lymph nodes in the knee area?
There are 3. You don't have very many lymph nodes in the knee, in the ankle, in the wrist, or in the elbow. You really will probably only have a few lymph nodes in the knee. The lymph nodes that clear the leg are going to be in your inguinal area, actually. So if you had swelling in the knee, you would want to brush your skin really, really, really lightly from the knee up to the groin.
Great. Is there still a lymphedema PT at the Corvallis location for helping those with lymphedema that is not caused by cancer treatment?
Unfortunately, the answer is no. Our lymphedema therapist, in fact, that's where I started my lymphedema treatment journey, was with the Samaritan Rehab Center. So I used to do all of the lymphedema treatments and evaluations and care. I only work in the cancer center now. We used to have Carrie Raymond down there on Ninth Street, and she treated the non-cancer lymphedemas. She had to move to the East Coast. So right now we don't have anyone, unfortunately, in the Willamette Valley who can treat non-cancer lymphedemas. I did start a clinic in Newport, lymphedema clinic with Samaritan outpatient physical therapy, and Stacy Wall is the therapist who has taken over that Newport clinic. So when there are people who need non-cancer lymphedema treatments, unfortunately, they have to go to Eugene, Salem, Newport, outlying areas to get treated for that at the moment.
And fingers crossed we'll be able to have more people nearby, right?
Right.
Yep. Okay, and one last question, unless more pop up. In general, are there any exercises, stretches, or overall movement practices that would support overall long-term health?
That's a good general question. So I can answer that from a lymph perspective. The lymph system doesn't have a pump. The lymph system loves movement. So let me talk about, can you still hear me?
Yep, I can hear you.
I just got a really weird bad network quality thing that popped up on the screen. Things that the lymph system loves: movement. The lymph system loves movement. Exercise in water. So if you were standing in a pool, in a swimming pool, doing knee kicks, knee bends, short arc quads, hip flexion. So basically standing in water or walking in water. Water gives you natural gradient compression from the bottom of the pool to the top of the pool. So that is a really good way to exercise and actually move lymph fluid. Any movement is good for lymphatics. The other things that, if you were to go see a naturopath for improving your immune function, which is your lymph system, they may recommend you get either a little mini trampoline. I usually prefer for my cancer patients for them to sit on a therapy ball and bounce. Rebounding is a fancy word for bouncing. So light bouncing is a really good way of clearing and detoxing the lymph system from head to toe. In terms of people who have been through the cancer journey, yoga is absolutely wonderful because it's using your own natural body weight to help even out all planes of the body. It helps you stretch your fascia and connective tissue that may have been affected by your cancer surgery or treatment. Pilates is also fantastic for people who are that spunky. Pilates includes, it's almost like yoga with bouncing, rebounding while you're doing your Pilates. Those are basically the things that I usually recommend my patients somehow, whether they're getting into a class or during the pandemic world, finding something that works for you through a YouTube video or an online exercise class is a wonderful way to keep your body moving and stretching. Exercise in general is going to improve your bone density. It's going to improve your cardiovascular system, cardiovascular functioning, and it also actually will help you as you age to keep your mental faculties as sharp as possible as you age. So I guess in general, that's how I would answer that question.
Thank you, Cindy.
Sure.
Doesn't look like we have any more questions at this time, but if any do arise, please feel free to email us at cancerresourcecenter@samhealth.org. Again, Cindy, thank you for your time. If anyone has any questions, again, please email us. And watch out for a follow-up email that'll be including a link of today's recording. We'll go ahead and close out today by saying thank you and have a wonderful day.
Thanks, everybody.